Welcome back. We've been following the story Becoming Christopher, which is Novartis Pharmaceuticals has kindly allowed us to use. One of the big things is there's a whole new category of physician. When I started training 30 years ago, we didn't have adult CF doctors. We didn't. We were as pediatricians, we really would see patients into their young adulthood. We have a whole new breed now. When I first came to Ventura County, we didn't have a cystic fibrosis team here. And over years, we've developed dedicated nursing, respiratory therapy, physical therapy, dietitians. Dr. Belkin, who joins us today, we were at a CF conference. He made the mistake of sitting at the same airport as I did. I said, "Where are you going?" He said, "Oh, back to Santa Barbara." And "What are you doing?" "Well, I'm finishing up my CF fellowship, but I'm going to be doing intensive care and pulmonology." I said, "No, you're not. You owe the CF Foundation some time back." And you'll see him laughing because that's what he's been doing, is really giving back for all the training that he's gotten and brought an incredible set of skills. And as we both learn together, as our patients become more and more elderly, we have a whole new set of skills to learn. Dr. Belkin, tell us a little bit about your training and where you live and some of your background. And
hello. I'm originally from the East Coast, actually from outside of Philadelphia. I did my medical training both split between the East and West Coast. I did my medical school training at the University of Pennsylvania, and where I met my wife, and we moved out to the Bay Area where I did my internal medicine training at Stanford University. And then I went back to the University of Pennsylvania Medical Center to do my training in pulmonary and critical care medicine with an advanced fellowship in cystic fibrosis.
I think you'd just given a poster. I think that I'm getting kind of elderly to be giving posters. I always try and bring whatever new research we're doing. And what was your poster on?
As part of my fellowship training, I actually did a master's degree in clinical epidemiology, and my thesis project was in the field of CF and lung transplant, and really trying to better identify risk factors for death in CF patients awaiting lung transplantation. The difficulty with lung transplant in CF is trying to predict the exact timing that patients should be referred for a lung transplant. And the real goal of my study was try to better define when should we refer patients to try to get them in the transplant window, which is the point in which patients are sick enough that they need a transplant but not too sick to undergo it.
And what we're really working on in our clinic, of course, is just putting that out for decades and decades. And we've been looking at opening up a second center with yourself as the director up in Santa Barbara, because we really have so many new cures coming out. We have 3,000 patients in clinical trials across the United States, and within the next 12 to 24 months, we need 9,000 patients in clinical trials. So just the geographic accessibility for care and accessibility for trials. I was very excited when you made the mistake of sitting next to me there. For me, as an intern at Stanford, where I did my internship in pediatrics, there's a patient, Michael Clark. And Michael taught me more about adhering to care and concordance with care, and more about adolescent fighting with their parents and with doctors. And I was told by Norm Lewiston, who is my boss at 6'5" and 280 pounds, that Michael needed to be on fat-soluble vitamins. And Michael said, "I'm not going to take a fat-soluble vitamin unless you find me a purple vitamin." And I found him a purple vitamin. And he's the one who really taught me that. He said, I like you as a person, but I'm hiring you for your brain, and that I work for him. And that's really carried me all the way through my career. How did you end up with cystic fibrosis as an interest like this?
My interest in CF really is multifaceted. Although it really stems from having a personal connection to the disease. Unfortunately, I had a brother who passed away from cystic fibrosis at age 30. I was a second-year medical resident at Stanford at the time. So I was already in the field of medicine, didn't really know where I was headed at that point. And when he passed away, and he was actually awaiting lung transplantation at the time, which has kind of sparked my interest both in cystic fibrosis and lung transplant at the time. I decided then to move forward into a pulmonary and critical care fellowship. In addition, I received a lot of great mentoring both at the University of Pennsylvania and at Stanford, which also helped guide me into the field of CF, and I was fortunate enough to be able to spend part of my fellowship training with some excellent CF specialists where I got my training in adult CF.
Well, how do we make that transition? We've been talking with some of the parents and kids here in the audience, but what are the mechanics in our clinic? When do we start?
Oh, I think the transition is something that takes place over time. You know, in Santa Barbara as well as in Ventura, you know, I will start seeing patients when, you know, they start showing signs that they're entering adulthood, and for some, the age may be different for each individual. You know, I see patients as young as 15 or 16 when they're ready to start making that transition, and sometimes it's older at 19, 20, or even older. And when they start having issues that are really specific to adults, where you need adult-trained physicians. So it's a process that takes time, and it's done over time, and I think the transition should take place with both the pediatric and adult specialists seeing the patient for a period of time to help try to smoothen that transition as much as possible.
And certainly the problems with adults are not beyond what I can learn, but I just as soon pass them off to you. I remember we have a young woman who wanted to look a little better in her wedding dress and decided to get breast augmentation, and it's not quite what I think of myself as a pediatrician, but we sat there in surgery with the anesthesiologist and made sure everything turned out. What are some of the other problems with adults that
Oh, you know, I have some patients who are one who's in his 50s, even had a patient where the diagnosis was made in someone in their 80s. And, you know, and these are issues, you're dealing with issues that are really common to anyone in the older age group, whether it be hypertension or hyperlipidemia, high cholesterol, and things that are dealt with by adult internists that need specific training in those issues.
I think that's a big piece of it. And you and I talk on the phone and by email, as I do with a lot of my pediatricians. We have newborn screening now, so now I get to tell a mom with a child who has absolutely no symptoms whatsoever about cystic fibrosis, and that we're really looking at a different lifespan than what she's going to go home and read about in Encyclopedia Britannica. And then for you, are there any kinds of special clinics where you might think about this? Are you opening any kind of multidisciplinary clinic where you might think about CF where most people don't?
Well, you know, what I'm doing in Santa Barbara is really starting a sort of what I call a sort of a suppurative lung disease clinic, which it really includes both cystic fibrosis as well as non-CF bronchiectasis. And I actually have a large percentage of patients in Santa Barbara with bronchiectasis, and I think that and we're making the diagnosis of cystic fibrosis more and more in adults because we're really starting to look for it. We're testing for it. We're sending these patients for sweat chloride tests. We're doing genetic testing on these patients. We're finding abnormal CFTR mutations, and so we're diagnosing more mild forms of cystic fibrosis. It's a little unclear what that means long term and what implications that has as far as prognosis. So if someone is diagnosed with cystic fibrosis at age 50, is that really going to change their life expectancy versus someone who is diagnosed at age 5? I think there probably is a big difference. And we don't know all the factors that go into why their disease is much more mild in some people versus others, but it is quite interesting.
Well, some of the issues that came up, we're doing parentectomy, as we call it, which is kind of surgical removal of the parent sometimes. We saw a hovering mom in that video. How do you help parents to make that transition? Do they still come in to clinic visits with the...
Absolutely. I mean, I think it's very important from the beginning to have the parents involved in the care. And, you know, at the same time, it's really important to let the patient start taking more and more responsibility for their own care. You know, I often get patients at the time where they're starting college and they're actually leaving home. And they're going into a dormitory setting, and all the issues of having CF and living in a dorm setting with other people and dealing with doing their therapies in a you know, having people who they don't know very well around them, and not having their parents there, you know, at all the time, and it's a transition, and so it's nice to have the parents there involved, and it's also over time nice to watch the patients really start taking much more responsibility for their care.